Hello everyone, welcome to Heal Your Heart Vasomeritic EECP Treatment Center. Today we are going to discuss a topic called coronary artery calcium score. So what is the coronary artery calcium score? It is a calcium deposit in the coronary artery or the blood vessel which is carrying blood to the heart muscle. So why does this calcium start depositing in your coronary arteries? So naturally around 99% of the calcium deposit happens in your bone and in your teeth. But sometimes this calcium can also deposit in the coronary arteries. For many decades there are a lot of research work has done and they have shown this deposition of calcium is directly linked to your chances of getting heart attack in the next 10 years, which is called a 10-year risk. So what is the reason this calcium deposition is going to increase your risk of getting a heart attack? For that, now what the clinical implication or how to treat this has emerged. So many patients with this calcium deposit in the coronary arteries, they go to the cardiologist, and when the cardiologist find they have a thick calcium deposit in your blood vessel, whether the patient is mildly symptomatic or asymptomatic, they try to open up the blocked artery which is calcified. And some of this patient is usually in India, they go for an alternative way to remove this calcium from the blood vessel. It could be any of the natural ways, some food intakes, and sometimes extreme cases they also do something called a IV chelation. This is EDTA which is injected into the blood vessels to remove the calcium. Now recently some groundbreaking research have thrown more light into this calcium scoring or calcium deposit in the coronary artery. Contrary to the belief that calcium in fact is going to increase your risk of getting heart attack or you're going to die early, in fact it shows the opposite effect. The recent studies have shown in fact if you have a high density calcium in your coronary artery, it actually prevents you from getting a heart attack. Now just think about somebody who are athletic, they do regular exercise and their good cholesterol is very high. So when they do the calcium scoring to these type of people, they found out they have high calcium score. So it's athletic and have good cholesterol and they have high calcium score. And then the opposite, for example, patient who have cardiac risk factor. We all know a couple of cardiac risk factor. So in these group of patients where they are diabetic uncontrolled or their blood pressure is very high, obese, smoking, and in this group of patients when they did a calcium scoring, they find out the calcium score is very less. So what really happened is if you have a high density calcium deposit in your blood vessel, it actually is a prevention because it can prevent you getting a heart attack in the future. At the same time, if you have all the cardiac risk factors, then your body will not deposit calcium into your blocks. So if the blocks are not deposit enough calcium, these blocks are called soft, and the soft plaque can break up and causes heart attack at any time. So in fact, in many of the studies they have shown people who tends to get heart attack frequently, when they did an angiogram, they found out the blocks and these blocks are devoid of any calcium deposit. And in many patients who always complained of chest pain, it means a mild chest discomfort when they do regular exercise, when they do a routine angiogram, they find out these people with chest pain, but they not got a heart attack, they tend to have a highly calcified artery. It means high deposit of calcium in the coronary arteries. So it is a surprising finding which is make us to believe that calcium deposit in coronary artery by nature, in fact it's not bad, it is healthy to prevent a future heart attack. So what is the reason this calcium deposit is preventing a heart attack? It's a simple because when there is a block in your coronary vessels, this block has a tendency to rupture or break, and once they rupture or break, it's a cause for a heart attack. But when people with have a calcium deposit into the blocked arteries, which is called high density calcium deposit or calcified artery, this calcification will prevent the heart blood vessel getting breakage, or the plaque will not get broken or rupture. So it has a preventive effect. So this is a new finding to show if you have a vessel with are highly calcified, don't get panic, because sometimes calcification is also going to be helpful for you to prevent the heart attack. Now another important question now I want to answer is, then why did we believe that high calcium deposition, in fact it's going to be bad, and have been treating this patient for a long time? The reason is, yes, calcium deposit, in fact, it's bad if it happens everywhere across your body, everywhere across your coronary vessel. The reason is, it is a predictor of heart attack because you tend to have more injury, and the nature is trying to cure the injury by putting a calcium into the injured artery. So if you keep on having more and more injury, it means you are a high risk for developing a heart attack in the future. So deposition of calcium, it's actually beneficial. It's not as bad as we think before. Thank you.
ஒரு இருதய நோயாளிக்கு பைபாஸ் சர்ஜரி, ஆஞ்சியோபிளாஸ்டி சிகிச்சை முறை தான் முன்னாடி கொடுக்கப்பட்டுள்ளது. இதற்கான மாற்று சிகிச்சை முறை EECP, என்ஹான்ஸ்ட் எக்ஸ்டர்னல் கவுண்டர் பல்சேஷன் ஹீல் யுவர் ஹார்ட் வேசோமெடிடெக் EECP ட்ரீட்மெண்ட் சென்டர்.